This presentation on horizontal hostility in nursing is brought to you by Gretchen Freilinger, RN. What is horizontal hostility? This was a term first used to describe infighting in feminist groups in the 1970s, women against women aggression. It's not just seen among women, though, making this a problem for all members of the team. Some key words and phrases that can help you to get the idea of the concept of horizontal violence are trash talking, infighting, talking behind others' backs, gossiping, and sniping. As Bartholomew mentions in the 2014 book Team Building Handbook, Improving Nurse-to-Nurse Relationships, horizontal hostility is something that can be obvious or hidden just well enough to almost be missed. There are two main forms of horizontal hostility, overt and covert. Overt forms often fall in line with the more commonly discussed bullying or lateral violence. Overt examples include name-calling, bickering, blaming, backstabbing, intimidation, gossiping, shouting, and finger-pointing. Covert examples include eye-rolling, unfair assignments, ignoring, refusing help, whining, sighing, refusing to work with a coworker, sabotaging, isolation, exclusion, and fabrication, or making up stories or rumors. Let's discuss a scenario with signs of covert and overt horizontal hostility. Nurse Jane says, "I really could use help in room 4 with cleaning up." Nurse Sadie says, "Sure, you go start. I'll be right there." Nurse Jane proceeds to the room and begins to work, awaiting Nurse Sadie's added help. Nurse Sadie never shows up. At the nurse's station, Nurse Sadie rolls her eyes in Nurse Jane's direction and says aloud to the other nurses, "Oh, she's just too needy. She needs to figure out how to do it on her own. I'm going to go eat lunch. She'll be fine." While other nurses are uncomfortable with Nurse Sadie's behavior, they say and do nothing to assist Nurse Jane. Red examples are overt and green examples are covert. Notice how in this entire interaction, the majority were covert. These are those under the surface, hard to address forms of horizontal hostility. Now you know why some resources call horizontal hostility insidious, or something that proceeds gradually and subtly with harmful effects. Why is horizontal hostility important? As a type of workplace violence, horizontal hostility causes patient safety issues. Those who experienced horizontal hostility in Wilson and Phelps's 2013 study in a southwestern United States hospital reported a higher frequency of taking unsafe patient care actions, such as failing to clarify an illegible order, lifting or ambulating heavy or weak patients without help rather than asking for an assistant, using a piece of equipment they didn't have training on and figuring it out themselves rather than asking for help, and completing an order the nurse did not think was in the patient's best interest, as well as other actions and behaviors. It can cause burnout. According to Thomas, in the 2003 entry for the American Journal of Nursing, horizontal hostility increases stress, thereby increasing burnout levels. Something to consider. In Hanning's 2018 study reviewing different aspects of the work environment for health providers that could cause turnover, it was found that a perceived effort-reward balance was more related to an increased turnover rate than burnout was. Do you think a toxic environment with horizontal hostility could reduce a nurse's sense of recognition for the effort they put forth? Lastly, horizontal hostility reduces trust. It's important to maintain an environment of trust to keep communication flowing. As an ethical principle of nursing, all nurses should strive to be as trustworthy as possible, not only for their patients, but for their fellow staff members as well. What can be done about horizontal hostility? Where do you start? In the 2014 handbook created by Bartholomew, some basic steps are outlined. I'll discuss these. You may be surprised to find you already know a few of them. First, it's important to know the difference between constructive criticism and horizontal hostility, so you can be sure you aren't an instigator and recognize when it's actually a constructive situation. Horizontal hostility often has no direction and is not intended to reach an end goal, whereas constructive criticism has an end goal of a corrective action. Horizontal hostility may use covert or overt tactics, whereas criticism deliberately works to spare the feelings of the individuals involved. Horizontal hostility, when questioned, often cannot be supported because it often has little to no basis in fact, whereas constructive criticism is based in reason and explainable. Both can be embarrassing, both can be hurtful, and both could happen at heated moments. It's important to remember that the words that you choose can deviate your comments between horizontal hostility or criticism. You can use this picture to help you determine if your actions are considered horizontal hostility or constructive criticism. Always remember that constructive criticism has a positive motive and a positive outcome, whereas horizontal hostility often has a negative outcome or a negative intention. To help mitigate the effects of horizontal hostility, you can work to improve your resiliency. This video walks through a method invented by Dr. J. Brian Sexton, a simple way to retrain our brains to remember the positive things in the day rather than the negative. I strongly suggest watching this. I'm not going to take you through the entire video, but I will tell you a basic overview of the program. In the last 2 hours before you go to bed, preferably right before you go to sleep, bring to mind 3 positive things that happened during your day. For help thinking of those positive things, you can think of your basic pillars of resiliency. Did something good happen in your relationship, in your behavior or reactions to things that happened during the day, in your self-care, in finding purpose in your day where you did something specific that was good, or in the way that you thought about things? Perhaps that's a little bit much. Consider the question that we ask each other at the end of the day. How was your day? Instead of asking that, consider asking, what went well? Why? What was your part in it? Don't just do it after work now. Make sure you do it every night. Turn this into a habit. You will notice a change within the first week. Remember, it's supported by science. Lastly, let's discuss what you're going to do when and if horizontal hostility happens to you. Be sure to strengthen your communication skills through practice. Look for opportunities for critical conversation courses and seminars through your workplace. Practice assertiveness skills. Watch videos. Work through the little hard conversations that you've been meaning to have with loved ones. Start small and work your way up. If you feel you might be at the receiving end of horizontal hostility, use the I statements as shown here in the image. This is similar to the DESC model you might already know, where you describe the event, explain how it makes you feel, suggest a new route of action, and offer consequences for continued negative action. You can even include your CUS model in the I statement through the initial I feel. Just follow with your CUS phrase of concerned, uncomfortable, or that this is a safety issue. Last, make an action policy for yourself. No one deserves horizontal hostility. It has no positive outcome. Record incidents in your own way when they happen, what you did or didn't do, and record the outcome. You can then reference these if it becomes necessary to involve a third party for resolution, since we all know that our memories don't always give us the exact truth. If you set an expectation, always follow through. This shows respect for yourself and sets the expectation that your requests will be met. In summary, horizontal hostility is a form of workplace aggression that can be obvious or hard to identify and creates a toxic work environment, undermines trust, and perpetuates feelings of oppression. It is important because it can create patient safety risks and increase burnout and turnover in nursing. It also makes nurses look untrustworthy and childish. But you really can do something about it, all on your own. Advocate for other nurses affected by horizontal hostility. Look inward and assess your own tendencies of horizontal hostility. Strengthen your resiliency and work to be a trustworthy, communicative, and just coworker for your fellow staff nurses, physicians, and other health workers.